Okay, thank you all for your patience and thank you for joining us for the UC San Diego Global Health Program MA info session. Looks like we have over 50 people joining us today, which is amazing. We're very excited to be giving you information on our new MA program, which began in fall of 2019. So we currently have our second cohort and we're in the process of reviewing applications for our third cohort. I'd like to introduce Seth, who's one of our faculty involved in the program as well.
Hello, everybody. Welcome. My name is Seth Hanna, Dr. Seth Hanna, and I'm the academic coordinator for the program. And Brittany and I will be switching back and forth in leading this session.
Great. Can everyone see my screen here? Okay. So, as many of you know who are joining us today, our applications are now open for the fall 2021 cohort. We only accept admissions and students in fall quarter of each year. So our priority deadline is December 15th, 2020, and our extended deadline is February 1st.
Excellent. So we're really excited to have this program going into its second year. The program is really, really unique. So it's the first global health MA program in the entire UC system. And it's really cool. It's a one-year program, so you get to get everything done and get your master's degree in only 1 year, which is really, really great. It makes it attainable. It doesn't take a whole lot of time, 2 whole years, a lot of extra money and expense of moving and living. Having a one-year program is really great. Another thing that the program does is it's interdisciplinary. So it's a global health program, but it's not rooted in the study of medicine necessarily. It's includes medicine combined with social science, policy analysis, public health, all these things brought to bear to think about how can we improve the lives and the health and the well-being of people all over the world, including right here in our own backyard and here in the U.S. and in our own local communities. The global is also local. The program also features small class sizes. You can actually have a chance to get to know your faculty and work closely with them and get to know them, which is really, really valuable. Being in a really big program with tons of professors, you're just going to be sort of one face among 30 or 40 students. It's a smaller program, which means a lot more individual time with faculty. And you can also do research or professional track in terms of the content of your program. So if you're doing the research track, you do a thesis and you do some of your own original research. And if you're on the professional track, you do more focusing on learning a lot of content, having a comprehensive exam at the end, and emerging with a lot of a nice professional portfolio of things that you learn and what you can contribute when you enter into the labor market. So those are just some of the highlights of the program. Thank you. So just to give you a little bit of an example of some of the additional highlights of the program. So in terms of professional development opportunities, you do have a chance to develop a actual portfolio of things that you've done, your activities, your research, and things that you've done while you've been in the program. You get chances to go and present your research at conferences or interact and network with other people in the global health field. There's also a lot of great resources here at UCSD. So we as a global health program have connections with other facets of our wonderful research university here. And so we have a Center for Global Mental Health. We've got the Global Health Institute. We've got established programs for you to get involved in research and caregiving in places like the the Health Frontiers in Tijuana program. There's also the Center for Comparative Immigration Studies, Center for Iberian and Latin American Studies, and Center for Healthy Aging, in addition to all the existing wonderful academic programs and faculty that exist throughout the UCSD community.
Great. So our MA in Global Health is the first MA degree in the UC system. And as Seth has mentioned, it can be completed in 1 academic year or 9 months. Our typical student profile it varies from global health majors, minors. We have some outside students from other universities who have a background in biology, health sciences, medical anthropology, medical sociology. So these are all the type of academic students that we're seeing that are attracted to this program. A lot of our students are interested in applying to a PhD or a medical school program following the MA, so they're using this as a stepping stone to gain additional experience and enhance their portfolio. We also have current undergraduates who are looking to pursue a career in the field of global health and go directly into working in management positions, working with NGOs. We require that our students have some global health related field experience, and we'll discuss that a little bit more in detail in a moment. And we also are attracting working professionals. Our MA in Global Health has a couple different focus areas. Our number one focus bullet point here is social epidemiology, which is factors creating the global burden of disease. We have our global health research methodology, which looks at design, execution, analysis of research studies. Our medical anthropology component looks at cultural variation and the experience of illness and treatment. And I think our medical anthropology component is really critical as the foundation in our undergraduate and our graduate program, and kind of bases how we view global health and how to approach healing, wellness. And then we also have global health policy and diplomacy, so programs and strategies for effective intervention, and then our program management component. So you're looking at program development, capacity strengthening, and looking how to actually run a global health or health program.
So a global health MA can really prepare you for a wide variety of trajectories throughout your career. And so the way that we're positioning this program is to think of it as a stepping stone that can lead in multiple directions. So if you want to go on and right after getting this degree, enter into the workforce and get a job, working for an NGO or working for governmental agencies, you can do that. We're going to give you the skills and experience that you can market yourself and be very well prepared to enter into the job market directly. But some folks just might want to build some additional layers of skills on their undergraduate training in preparation for further graduate study or further professional study. So if you wanted to go to medical school, or if you wanted to go get a PhD in anthropology or sociology or any other field, but you want to focus on the intersection between health, society, and how these things, vary and play out around the world, and you want to do global health work, then this is a great program for you. Say you want to be a doctor, but and you think you might want to work in international settings. Well, why not come and do a program like this first? It's going to give you an additional layer of a unique perspective on. It's going to make you do a better job when you go out there and ultimately start doing that work. So it's increasingly recognized that the best health professionals will have interdisciplinary perspectives. No one field has all the answers, right? You can be a really awesome doctor and know the medical sciences, straight and cold, and be a really fantastic person at diagnosing and treating illness. But like earlier in our presentation during quarterly conversations, like they said, if you don't understand the larger social, cultural, and political dynamics that are at play that are basically driving the underlying cause of the illness that your patient is experiencing, then you're not going to be able to really address the problem in the most effective way. You need to be able to understand how all these forces interact to produce whatever is ailing the patient. So it's really important to have that interdisciplinary perspective, social and cultural skills and acuity, way of understanding the way culture, plays out in the doctor-patient relationship, or the way, structural violence and poverty affects somebody's access to healthcare and their likelihood to be sick. You're going to be able to learn all of these things in our program. And so this is going to really prepare you well for that. And that's what we try to do well in the program. Great. And so just to follow up on that, you might be wondering, hey, what's the difference between, going to do a global health MA compared to going to, say, for example, to get a master's in public health? What is different about the global health MA? Well, there's subtle differences, but important differences between these different disciplinary perspectives. Public health is a field that has a long history. It's been around a long time. It's got a clear sense of like, what are its core things that it's all about, right? The 5 competencies of traditional public health are epidemiology, biostatistics, behavioral health, health education, environmental health, and health services administration. Each one of those things can kind of stand on its own, but they kind of have something in common. They all focus on populations, they focus on prevention and health promotion, but really it's rooted kind of in an individualist perspective about individuals manage their own bodies and their own health, and how us as policymakers can intervene and create programs to sort of create behavior change among the population to help them become healthier, right? So it's about those interventions are a little bit more rooted in individual transformations of people's lives. And that's not really exactly what we're doing here in global health. We have a different vision of what's at the root cause of health problems. And it's not the individual decision-making of particular people, right? It's about them and how they're situated in their communities, in their own experiences, what they've faced in their life, whether they've been victims of stigma or persistent poverty or victims of violence, whatever it is that's leading them. Maybe they're living in an area that has elevated pollution. Thinking about all these things as a system and how they work together, that's what global health is all about. It's not just about building a program to go deliver some particular medication to a place that needs it, or to go do an anti-smoking program or anti-vaping program in a community to get people to sort of live their lives in a more healthy way. That's not the same style of program or the same type of field as what global health is, right? Our program is grounded in the social science understanding of the global burden of disease and the social basis, right? The social basis of complex dynamic health challenges in low resource community settings and in a globalizing world, right? We emphasize the skill set that you'll need for analyzing global health challenges with respect to those health-related social processes, right? The relation between health and social justice, health consequences of structural violence, and the cultural factors that influence the way illness and treatment is carried out, right? This is a different approach than what they're doing in these other programs like MPH programs. And a Master's of Science degree is more of like focused on statistics and science and is not as sort of multifaceted as what we're doing here. Is this still me, Brittany?
Yes.
All right. Yeah. So if we're gonna be effective at building a new way of extending our global reach and promoting health around the world, if we're gonna be effective at building global health policy, research, and practice, we should consider all these factors at the same time, concurrently, right? We should consider society, culture, relationships, experience, and move beyond just the biomedical definitions of health and disease to include those local understandings and considerations of how broader contexts and determinants shape illness and well-being. So we feature diverse methodological tools, including qualitative and quantitative or mixed method analyses. And we also come from a more critical, exploratory, and theoretical perspective as well, right? We're not just, taking the body of knowledge and best practices as given and applying them. We're questioning constantly. We're trying to improve, innovate, and theorize about how we can improve global health practice over the long term. And that oftentimes means self-critique, right? Reflecting on our own practices and how we can improve them. So I think that's one of our really things that is strong about our program and what sets us apart from other types of professional programs in this area. We also incorporate ethical and equity-based considerations in all stages of our work. It's built into the mission of our program that we're trying to promote health equity, equal access, and to improve the health of everybody and not have a disproportionate effect on different populations depending on their relative status and experiences.
Great. So now that you have a little understanding about the theoretical and academic framework of our program, let's talk a little bit about what our requirements are to apply and to qualify. So you'll complete your online application at GradApply, and with your application, you'll submit 2 essays and writing samples. So these samples are going to be pieces of work from previous courses. It does not have to be global health related, but I will say it is recommended to have some health or global health content. It's completely fine if you don't have anything, but it does show the reader that you do have some health background and that you can articulate global health and health frameworks well. We also ask for your resume and CV and a statement of purpose, which I want to emphasize the value of your statement of purpose. So you're going to include your interest, background, and how this program fits in with your future goals. This is your chance to show us how passionate you are about the field, about how this program is going to fit into giving you opportunity to, fulfill your career dreams. But really what our faculty readers are looking for is students who are passionate and have a feeling of purpose to do this type of work. So this is your time to shine. Talk about if you've had experience in clinics, how this has changed your perspective. What's led you to want to get involved in global health? What was that moment for you? You'll also include your transcripts and 2 to 3 letters of recommendation. 1 letter does need to be from a faculty member that you've worked with or taken a course with. Your second letter, it can be from a faculty member, it can be from internship field experience supervisor, it could be your employer, someone who's observed your work ethic and can speak on how you'll do as a student or how you've done in the workplace environment. So to qualify for the program, you'll have to complete your bachelor's degree by the time the program starts in fall quarter, which is late September for us. So if you have 1 or 2 classes left in summer to complete, that's fine. We do want to see that our students, if you're trying to be part of our contiguous program, we do want to see that you've completed all the Global Health Core, the Global Health 181, Essentials of Global Health, and our Global Health 148, Global Health and Cultural Diversity. So we're looking for candidates who have a 3.3 GPA. However, we do encourage students with lower GPA who are very passionate to still apply. We use a very holistic approach when reviewing our applications. We look at the whole package. So if you have good recommendations, if you really convey your passion through your statement of purpose, and you have additional experience that's going to make you a valuable candidate, then that's something that we really do place a lot of weight on. So that brings me to the next point, that you need to have completed a global health experience. This can be international or domestic, or we want you to have postgraduate related volunteer work experience. So this could be working in a healthcare facility, even here in San Diego, being a part of the Peace Corps. And one thing we always like to tell our students is that the US is part of the globe. So doing work here in San Diego doesn't mean it's not global health field experience. We look at you're working with diverse populations with different cultures, backgrounds, and we still view that as part of global health field experience. So we're very broad on that. We want you to have completed undergraduate coursework in global health, medical social sciences, international studies, or related fields. So we do want you to have some framework and understanding of some global health topics or health-related medical social science topics, medical anthropology. You will also need to have completed a statistics course, which you can complete the summer prior to beginning the program. And one thing to note is we have previously required the GRE, however, we no longer require this exam. The current application fee is $120 for US citizens and permanent residents and $140 for international applicants. There is a health fee waiver that you can apply for on your application. If that is denied and you are unable to pay the fees, please reach out to the department and we'll see if there's anything we can do to help. Sometimes we're able to give out 1 or 2 additional fee waivers. So please first go through the process to apply for it through the system, and if not, reach out to us. When do I apply? So you will apply for undergraduates fall, winter of your senior year. So if you're a senior this year, you'll apply now to begin in the next fall. Graduated students can apply at any time and during our application period, which is from September to February. And you must complete all undergraduate requirements by the time the program begins in fall. And one thing to note about that, I've been getting questions from students asking if they can use courses from their undergraduate time to fulfill graduate electives or requirements. And the answer to that is no. All of your coursework for the graduate program has to be completed when you're at graduate student standing.
Oh, this one's for me. Okay. So the program requirements are going to be 9 courses. Okay. We expect you to maintain a certain level and standard of performance. So you should maintain a 3.0 GPA for all coursework, both cumulatively and for each quarter. And then students will have this choice, like I spoke about at the beginning, between a professional track or a research track. And the end result, the main product that you have to produce at the end of your time here, it will be a comprehensive exam if you're a professional track student or a thesis. And I'll go on to tell you a little bit more about what those assessments look like and what that thesis looks like. But if you are going to select one of these tracks, you should probably think a little bit ahead of time about which one you might want to do. The earlier you prepare, especially if you're choosing the thesis track, the earlier you prepare, the better. And you should try to select which track you're on relatively early in the program by about halfway through the fall quarter. Okay, so what are the courses? So the main core courses here involve Global Health 200, which is the Global Health Master's Course Seminar. I'm actually the instructor for that course. We're going into the 3rd week of that course, and I'll mention a few more words about that a little bit later. The next one is Global Health and Program Management. And then we have Introduction to Global Health Research, Social Epidemiology, Global Health Policy, and then the Psych Med Anthro seminar, which is basically a research seminar that occurs once a week on Mondays that doesn't require you to register for it each quarter, but your attendance is expected. So basically it's an awesome research seminar where we bring in researchers from around the university, around the country, around the world maybe, who are doing work in this area of sort of anthropologically and social science focused global health research. So the leading researchers in this field will come present to our group and share their most recent research, and then we get a chance to talk about it and share ideas and build community around this shared interest. So just a really great example of this was one of our own graduate students who's a PhD student in the anthropology department. Her name is Miranda Wu, and she gave a really brilliant talk this past Monday about her research in Hubei province in Wuhan with people there who were experiencing the onset of the COVID-19 pandemic. And so she was having deep conversations with them about how their lives were being affected, especially how their mental health was being affected by the onset of the virus. And it wasn't so much about what happened with the quarantine and lockdown measures and how did it affect them. It was more about also like how you internalize the perception of risk and your future, and really worrying about how this is going to affect your life going forward. It really produced a lot of elevated anxiety and depression and suicide ideation during this time. And so she shared with us some really great narrative material from her interviews. And it was really a great exemplary example of the type of work that we are trying to promote doing in our program, and what the Center for Global Mental Health is also trying to do. So this is a really great chance for you to interact with senior faculty, with other graduate students, and to really contribute to a knowledge community, right? To build and contribute to furthering along high-level research in this area. So I think it's a really precious and important part of our program, and I think that you'll really enjoy it if you come and join us. You'll really enjoy that as a really key part of your experience. Brittany, I think you're muted.
There we go. So we have we have 9 courses total. We have 6 core, and then you have 3 elective requirements. So of those electives, one must be a 200 level global health graduate course. So we offer 1 global health graduate elective at the minimum each quarter, and those vary in topic each year. Some students occasionally will petition to enroll in lower or upper division graduate courses, so 100 level courses. However, that is only approved in the absence of relevant graduate coursework, or if it's a course that's going to help support your thesis writing. And if you're completing the research concentration, then you must enroll in a minimum of 2 Global Health 299 independent research courses with an affiliated faculty member. So you'll take a Global Health elective in fall quarter, and then in winter and spring, you're going to enroll in the independent research course. And the independent research course is designed to give you the time to be working on your thesis and speaking with your advisors, getting feedback, getting resources, doing literature reviews, working on your annotated bibliography. So you're going to be building your thesis in this time. So while the professional track students are completing coursework, this is what you'll be doing in lieu to complete the thesis.
And it's really important, right? Like you get
Right.
like you do less like classwork, right? So this like it relieves some of your burden of reading and writing for other classes and allows you to focus on your own production of knowledge and what it is that you're doing for your thesis. So it's an important protected time and a chance for you to spend a lot of time with your advisors as well.
Right, I think that's really important. So one question I've gotten is, which do I think is more work, the thesis or the professional track? And I really do think they are equal workload because of this designated time. And also independent research, a lot of this, you will be independent. So you will need to be a proactive person who's going to be reaching out. So you can't expect your faculty advisor to really be staying on top of you. It's more of you're going to be making these efforts. It's going to be an independent experience for you with feedback from advisors. So if we have students who are coming from outside UCSD or they haven't completed our global health core courses, they will also need to complete additional courses that will be in place of your elective requirements. So you'll complete the global health and cultural diversity course, which all of our majors and minors complete, and then also our essentials of global health course. So if you're a current UCSD student and you're not even, say you're not a major or minor, you can still complete these undergraduate courses, our Global Health 148 and our Global Health 181, and that'll basically help you get prepared for the graduate program. Not only is it a great foundation to have to get the program started, and we highly recommend it, but it will basically allow you to take more graduate level electives that are gonna provide more value to you. So here's a sample plan of what your fast-paced one-year program is going to look like. So for our research track and all students, in fall quarter, you'll take the health course, or Global Health Master's Course Seminar, so Global Health 200, and then our policy course is typically offered in fall, and then you'll have the opportunity to take a Global Health elective. In winter quarter, all students are going to take the Introduction to Global Health Research and Social Epidemiology. If you're on the research track, you'll complete the independent research course. And if you're on the professional track, then that's where you're going to complete another elective. And then our Psych Med seminar is you receive credit in spring quarter. However, you're going to be attending seminars throughout the whole year. So it's a little bit, it's less intense than a course in spring quarter. And that gives you time for professional track students to work on your case study and to work on your portfolio and study for the exam and prep for that. And then you'll take a global health elective and complete the independent research for the research track. For the professional track, we kind of just showed, if you say you had to take the, oops, that's actually a mistake there, the Global Health 248, that's not correct. So you would actually take a two global health electives in the 260 in the spring quarter. And then you'd advance to candidacy and you would graduate at the end of spring quarter. So when we talk about the elective options, we have special topics that are frequently offered throughout the year, and those will vary depending on the faculty we have teaching for the program that year. So some past topics, community health workers, theoretical approaches to race, diversity, culture, and health.
My course.
Yes. And yeah, students actually really loved that course. They said it gave them a different perspective in global health, I think more from like a medical sociology perspective. And so right now we are offering substance use and global mental health case studies for research and practice. So that's for our students this year in fall quarter. So some other courses we've had, 212, experiencing epidemics, anthropologies of infectious disease, and that one definitely has a heavy medical anthropology approach. We have a course we're offering this year and hopefully, subsequent years, the program design and evaluation, clinical perspectives in global health. We have a course on Native American health and healing. History will offer a course occasionally on science and public policy. And then the School of Global Policy offers courses on health economics, humanitarian interventions. So there's not too much opportunity to take, a lot of electives, but the ones that we do offer in our program and through other departments are very relative to the core of our program, and the offerings do rotate every year. So, it gives you lots of options. Okay.
Okay, so I just want to talk a little bit sorry, there's a phone going off downstairs, sorry. So I just want to say a little bit more about the research track and the professional track. So the research track, I'll just say, like, you might be wondering, like, what kind of like research constitutes a thesis? Like, what does a thesis look like? And I'll just say, like, in the time that you have in this program, being a year program, it's usually not enough time for you to conceive of a large project in which you're collecting a lot of your own original data, because that involves, IRB, human subjects review, and a lot of other layers of bureaucracy. I'm not saying it's impossible, but generally it's more challenging to do that kind of a study. So most likely you'll be joining up with the faculty member who has their own ongoing research project in which you can collaborate, you can access and use their data. You guys might work together on a project, or you might do like a really in-depth literature review and study in a particular area that involves, deep case study and looking at the broad scientific evidence on a particular area that you're interested in. So it's not necessarily like you have to, do this own independent, brand new research project where you're collecting all this new data and analyzing it. Unfortunately, there's just not enough time in the span of 1 year to usually get that done. But that doesn't mean you can't do something that's new and interesting and original and innovative. So you have to sort of walk that line, and a lot of it's going to depend on the faculty members that you assemble as part of your committee. The professional track students, don't envision themselves going on to graduate school necessarily, and they're just wanting to build a set of skills and experiences as they move on to the next stage of their career, and they want to go on and get a lot of work experience right on the ground. And so here, those students, this is much better suited for them. They can emerge with a body of knowledge that they've mastered, and they've got a very solid set of evidence to show, like, here's what I've acquired at this program, here's what I've done, and this is what the portfolio does for you. And the fact that you've passed the comprehensive exam also is very useful in signaling that you've mastered a body of knowledge. Excellent. So what does that comprehensive exam look like? So, it shouldn't be something that you get really scared about, right? Like, this is not something that you feel like, oh my God, what if I don't pass the comprehensive exam? It's going to be this really high bar that I have to hurdle. We just want to know that you understand the basics of our approach to the study of global health, the key concepts, the key ideas, the key approaches, the key analytical frameworks. And it's going to be in the form of an essay exam. So it's going to be a closed note half-day comprehensive exam that'll consist of just short answer questions and then a selection of longer essays where you'll be able to choose a few options to answer from out of a list of possible questions. And they're going to cover our main areas. Do you understand the main disease issues that are affecting the world? Do you understand what disability adjusted life year is? And then do you understand the principles for global healthcare delivery? Do you understand the way that you need to tailor your approaches to cultural conditions and structural and social conditions on the ground? Do you understand what structural violence is? Just very fundamental, important but straightforward aspects of our courses of study that should not be a mystery to you at all if you've successfully completed your courses. So this is sort of like a little bit of like a final exam from a course, but just a little bit amped up and compressed into one session. So there's also a case study component as well, where you will be responsible for reviewing, analyzing, and proposing solutions to a particular global health problem or topic. So many of you enter this field and come to a program like this because you're passionate about some area of global health. And so you can use this as your opportunity to go more in depth into that area of global health that you're really passionate about. And so this is why I think the case study requirement is really great, because it's a venue for you, even if you're not on the thesis track, to direct your attention towards that area of study that's most important to you. So you feel like you're getting something special out of this program, an opportunity to think deeply and to work deeply on an issue that you're passionate about. And so I think you'll find that a really good component of the program. So you'll define the underlying scope of the problem, discuss what we already know about it, discuss what kind of policy frameworks are involved, what kind of interventions have been done, and then consider all the different factors that might determine the success or failure of this issue. Why have we made progress? Where have we made progress? Where haven't we made progress? And how do we explain and account for that? And so what you learn in terms of that balance, like how do you then create new solutions based upon what we have learned? So that's basically how that goes. So the thesis is about 10,000 to 12,000 words, so it's about 40 to 50 pages. So it's pretty long, right? And you have to ahead of time, you have to submit an application to do the thesis. You have to propose an idea. You have to assemble a committee that has 3 faculty members on it, an advisor, and then 2 additional people. And these are the folks that will monitor and guide you through your process. And so you have until week 5 of winter quarter to assemble the entire team. So you apply and submit, by the end of fall quarter to do the thesis track, right? But then by the middle of the winter quarter, you need to have all of your faculty assembled and be really ready to go. And then you work until the end to complete things. So Courtney Bardier, oh, sorry, that's okay. So that's okay. We can skip it. That's okay. At the end, you will have to do sort of what's called a thesis defense. And if you're not familiar with this, what it means is that you have to sort of subject your production of knowledge to the scrutiny of your peers and your faculty and your advisors. And so you have to say, here's what I did, here's what I learned, here's what I think about it. And then they have to evaluate the strength of your work. And so basically it's like a 2-hour Zoom session where you talk about your work, and then there's a Q&A afterwards in which you sort of, parry, usually softball questions, but sometimes the occasional tough question. And that's just so for you to publicly, subject yourself to a little bit of critical scrutiny. But most of the questions that come up are things that you've dealt with in the construction of your thesis. So that's not something to be super scared about. It's a chance for you to share all the hard work that you've done with your peers. And it's really more of a celebration than it is a public examination.
Absolutely. Yeah, this is nothing to be intimidated by. Your committee would not have let you get to the point of having a defense if they were going to be criticizing you or fail you. So as Professor Hannah said, it really is just a celebration and kind of displaying your work for people to see. So it's a pretty fantastic event. Kind of makes you feel that you have some closure and some, it's like a grade for your exam. You get a pass.
Absolutely.
So something we require of all of our students in the program is to develop a portfolio. And in this portfolio, you're going to have an executive summary of your overall learning experience in the program. You'll write a competency statement where you're going to reflect on your interests, your strength, your skills, area of topics to pursue further. You can also include materials to support what you've learned, course assignments, writing, materials and whatnot. And then you'll have a professional statement and goals, which is going to be valuable when you're applying to any job or graduate program, med school, a resume or CV, and then you'll include your final case study project. And as I said, any other work samples. So I've seen from our students who've just completed the program this last year, they've been sending their portfolio when they're writing to professors to ask for letters of recommendations for jobs. They're submitting their portfolio when they apply for jobs. And they've been getting really good responses from that. And I've had students ask me for a letter of recommendation to include this, and it's given me so much material to really write an in-depth and intimate letter of recommendation, more so than the standard one that I would probably have written otherwise. So there really is, this is a good investment of time for your future. And that's something that we really focus on in this program as we're trying to prepare you for your next steps, whether that is going into the career field or into further education. So this is, pushing you to get started on your statements, to get started on improving your resume and making you employable. So that's really our job. And we seek to have professional development opportunities for you so that you can enhance these, resume workshops or fellowship, or we kind of survey what our students in the program need and want and develop resources to help you get there. So let's kind of switch gears to financial for a moment here and talk about the cost of the program, how you can pay for it, and some other ideas for you. So for 2020-21, the cost of attendance for a graduate program at UCSD is $17,385, and that is including just tuition and fees. So that includes your health insurance, $960 in campus fees, and then $12,000 in tuition. The rest of the details here are housing, all of that. So that's something that I'm going to let you kind of look at separately. Additionally, if you are a California non-resident, there is an additional supplemental tuition of $15,000 a year. So it definitely increases the cost of the program. So I'm going to come back to this slide in a minute. I want to talk to you about a few ways that our students are paying for their tuition and fees. One option you have is to gain employment as a reader or a TA in any program or department at UCSD. So we're very fortunate that our first 2 cohorts of students have all been gainfully employed. And as a reader or TA, if you have at least a 25% position, which is 10 hours a week, it covers your registration, tuition, and health insurance. So when I go back to this slide here, of this $17,000, the $12,000, the tuition and fees gets covered. So if you break that down, it's more like $3,000 or $4,000 and change, let's say $4,200 each quarter for tuition. So each quarter that you're employed as a TA or reader, it's going to cover that. And then it's going to cover all of your health insurance fees. The only fee it does not cover is $960. So you're looking at $320 each quarter that you're going to be responsible for if you're employed as a TA or reader. Some of the positions and occasionally will cover non-resident tuition, but it is rare. So I wouldn't count on your non-resident tuition if you're from out of state necessarily being covered, but I have seen it done before, so I wouldn't rule it out completely. And then with that being said, so our students can be employed up to 50% per quarter, so that's 20 hours. So the Global Health program has a few positions available each quarter, and we work closely with the Department of Anthropology, who employs many of our students. This year.
Hey, Brittany.
Yeah.
So there was a question in the chat about like how accessible are these employment opportunities. I answered that I think, that the students who want/need these employment opportunities, they get them. Are there students who really desperately need or want employment, but they have not been able to get them?
Not yet.
Yeah, not yet. We anticipate that everybody's going to be taken care of.
We make it our goal to help you succeed in finding employment. So I start contacting, so basically you can start applying for employment as soon as you accept your admission to the program. So then you're going to log into this database called ACES, and you'll see all the open positions posted from other departments. So Global Health, sometimes for some of our strong applicants, we offer out TA or reader positions as part of our funding package. Otherwise, we don't have any funding that we offer to our students for admission. I'll talk about a few other funding options that we do have for extracurricular type of professional development opportunities. So students begin being very proactive right away for this. And so we have our students employed in biology. There's the literature program. So if you speak a second language, they really do, need a lot of students to teach Spanish, Arabic. There's many courses. And then we have, there's a writing program for each of the colleges, so they often employ a lot of grad students. So as I said, we've been very fortunate that our students up until this point have all had employment. And so, we hope to keep that going. We obviously can't make any promises, but I definitely work hard with you all summer to make sure this happens. And even some students, if they hadn't found employment, last minute departments are sending out things like a week before school starts. So there's definitely a lot of opportunity. I have seen personally that even just the week or two before school starts, that suddenly a bunch of departments, human development, literature, some other departments have been sending out that they have all these positions to fill, and all of our students are employed. So I actually imagine that they have a hard time finding people to fill those positions. So that would just be my inclination on that. So it's definitely a very viable option for our students.
Mm-hmm.
So in addition to funding through, you could apply for financial aid. So graduate students can get financial aid. And then with the employment opportunities, there's also other funding opportunities on campus. So there's the Graduate Student Association. They are basically a hub for all graduate students to kind of feel connected to the community, and they provide career workshops and academic and non-academic events. They have career nights, socials. The social events have obviously looked a little bit different this year. So they also provide funding for conference travel, or if you want to host a grad event on campus. So that's something to think about. The Global Health Program encourages all of our students to participate in global health-related conferences, and we do provide some funding for that. So there's UC Global Health Day, the Center, or the CUGH, so the Center of University, or Consortium of Universities in Global Health. They have a yearly conference, Unite for Sight. So we share all these opportunities with you. And this is part of the professional development in the program. So we're trying to get you to build your resume as much as possible, and we're always looking for ways to help financially support you in that role. So with that being said, this is basically the end of our presentation in terms of telling you about the program. We received some questions beforehand, and they're questions we are frequently asked. So we're going to answer a few of these frequently asked questions, and then we're going to answer some of your Q&A questions live. Feel free to start typing questions in the chat. We'll answer some of them through the chat.
Brittany, maybe we should start with the questions that students who are here in the room for sure already have. And then we can get to any of these other questions that they might have, but they're just not thinking of them right now.
Absolutely. Okay. So when do we hear if we get accepted to the program? Let's answer that one. So we have our first deadline, our priority deadlines in December, and within a week or two of that, faculty start reviewing those applications. And we'll usually give out, so we anticipate we're gonna have a cohort of about 15 students. So we'll typically give out about 8 slots. If it's a competitive, round of applications, if they're all kind of on the fence, then we're gonna wait till we look at it at the February deadline and put those all back into the pool to reconsider. So some students are going to hear early January if we're able to get the committee together before the holiday break. And sometimes students will hear before the holiday, but I would anticipate probably early January if you submit by December. But if you submit by December and you don't hear from us in January, that doesn't mean you're not going to be accepted. Sometimes in December, all the applicants we would like to admit, we just need to hold space for the rest of the applications to review. But sometimes we'll end up admitting mostly all the people who applied in December. So, and with that, you'll know by the end of February, early March, if you're being accepted into the program. So that gives you some time to plan. And then that leads to another question of how many students get accepted to the program per cohort. So we began the program our first year with 8 students. We moved up. Our goal is to have 15 students per cohort. Eventually the program may expand closer to 20, but at this time, with the faculty level of commitment we have, our goal is 15. And so another question is how many students are applying? And that it's really, it varies quite a bit. So between even the first year and the second year of the program, I anticipate that we will have more applications this year due to COVID. I think some students definitely are considering grad school now because of the environment they would be graduating into as an undergraduate, which is completely understandable. If it's something that you're considering, it could be a good time to do it. I would say we maybe get last year 40 to 50 applications. And of those applications, I would say 60% of them were strong. So it was pretty black and white looking at the applicants of who was going to get in and who was not. So, you know, like we said, our typical student profile, you have your field experience, you're showing passion, GPA important, but not the end all be all for us. If you kind of have that background that we're looking for, then you're a good applicant for the program. So that's.
So can we, so is the health insurance fee waived? What's the answer to
You
that
can.
question?
Yes,
Yeah.
if you have your own health insurance, then you can waive that fee. So there's an online portal, you'll go in, you'll submit that you have proofs.
Right.
A lot of students are on their parents' health insurance until 26. So that's.
I think we have sort of answered the priority deadline versus extended deadline question, right?
Yes.
Okay.
So anyone, yes, you can turn in your application anytime between now and February. You'll just get looked at earlier if you turn it in by the December deadline, but we still leave spots for the whole pool of students.
Yeah.
So what's your advice on getting to know your professors now that we are virtual? That is a great question. Mr. Hannah, tell us your experience with that.
You know, this is actually the best time ever to make connections with professors, to be honest with you. You don't have to worry about a limited time window of when they're going to be in their office. You don't have to worry about the stress and anxiety of showing up face to face and having to deal with any kind of social awkwardness of being in the room. Faculty are going to be more flexible with their time and when they can meet with you, because all they have to do is turn on their camera. And so it's just a matter of you reaching out and being proactive. And the first step, obviously, is just if they have publicized office hours, don't just go when you need something. Literally show up every single time. I have students that come and see me every single office hour. And they just pop in to say hi, and we talk for 2 or 3 minutes, and then they say, okay, I'll see you next week. And sometimes, nobody else shows up in office hours, and we'll talk for 45 minutes. So if you show up, if you are there, if you show and demonstrate an eagerness to get to know, and you value what that professor can share with you, trust me, we like that. We want to have that opportunity to share our thoughts and provide that support to our students. I know I for sure do, and I know the other faculty here in Global Health definitely feel the same way. So it's just a matter of being consistent and really not being afraid to reach out multiple times. If you don't get a response the first couple times you write, maybe they're busy, maybe your email went down to the bottom of their queue. Just keep on trying, and don't sort of get discouraged by a lack of initial enthusiasm. If you demonstrate interest, you're going to get usually good response in return. So I wouldn't stress out about COVID and about things being virtual. I think you just you have to make your presence felt, and you have to just be flexible about when you can schedule appointments with them, just the same way that they do with you. And it's easier than ever now with Zoom meetings, as opposed to limiting to when I'm in the office.
Absolutely. Okay, so we have another question we can answer live here. So can we apply to this program after finishing senior year of undergrad, or only during senior year? So
Anytime.
once you graduate, you can apply it any year you want. In our first cohort, we had a student come back who graduated 2 years ago. So that's definitely not a problem. Yeah. Especially if you've graduated and you're out there getting some good work experience. I think that's really, you could enhance your your opportunity to get into the program, your chances. So
Mhm.
you can use, if you're using that time wisely, that might be a smart thing to do for some students who are kind of on the line.
Yep.
So what is the percent of students accepted each year? So kind of as I said,
Oh, yeah, we answered that one.
yeah, I think we kind of answered that. So it will depend on how many applications we receive. So if we,
Yeah.
you know, I would
And this
imagine 30,
this last
40%.
one, yeah, if you just do the math on that, if you're getting 50 or 60, and then we're trying to ultimately enroll 15, it's all going to depend on how many people decide to accept our offer or not.
Right.
So
So just because we have 15 students, that doesn't mean we only accepted 15 students. That probably means we accepted 25
yep,
and
yep.
15 decided to come. So we definitely, there's an attrition rate. So
So that feeds into this last question. If accepted, when would you have to accept the offer by? What if you're not 100% sure of your post-grad plans yet? I mean, there is some outside risk that if you wait too long to give us an answer, it could be,
yeah, they're
it could be an
definitely
issue, right? Like you don't want to delay and delay and delay and delay, because at some point we're going to say, like, look, like we want you to come, and we can't, hold these spots forever.
right. So we do give a deadline. I want to say sometime around May. Um, I'll have to check in on that, but when you get your admission offer, it will have a deadline on there imposed by the graduate division. Part of that is we need to start doing the processing. Another part of that is that we have students on a wait list, so we need to know if you're coming in. Otherwise, we're going to allow other students into the program. We've occasionally had a student, deny admission and then come back a couple weeks later and they've had a change of heart. And if we still have room in the program, sometimes we can work things out, but I would kind of, um, you know, be prepared to have your answer by summer, the beginning of summer. So we have 2 global health faculty from the letter of recommendation form. Oops.
Oh, I sent it. So this is a question about, like, who can write letters for you, and I don't see any reason why you couldn't have all 3 global health faculty write letters for you, right? Like, letter's a letter. Does it shouldn't matter like where the letter comes from, right, Brittany?
So we do want to see a faculty, but I want to show students here. So we have a form on here. And this form was designed to make it easy to get you a letter of recommendation. So you can actually, it says fall 2020 cohort only. We're updating that. You can use it for right now. If there's a UCSD faculty member you want a letter of recommendation for, you can send them this form to complete. And what happens is when you're completing your application in the portal, you're going to put in who your letter of recommendations are coming from, and it's going to create a email that goes out to your recommender to upload a letter, and your recommender can upload this letter. And this is going to be a lot quicker for them than writing a letter of recommendation. And they write a few comments, they score you on your academic abilities, your communication, your writing skills. All of these are things, again, that we want to see in our students. So kind of looking at this may even help give you ideas of what's important to write in your statements of purpose.
Mm-hmm.
And so this is just one way to help streamline that process, because we know faculty are getting bombarded with requests. So this is anyone at UCSD. Outside, you'll need a letter of recommendation from outside. But yes, we do want to see one faculty member. I've had students not able to get a faculty member and they still apply and we'll still consider it. So it's going to help to have, a faculty member can kind of comment on your work ethic and your academic abilities.
So Brittany, you're saying that, like, when you apply, if you're a UCSD student, that they want you to have one of your recommenders be a global health faculty member. Is that what you're saying? That if you're, say, a bio major at UCSD, you need to have.
No, it doesn't have to be global health.
Oh, okay. So just to clarify, like, if you're applying to this program, you need to have 3 letters of recommendation total. One of those should be from an academic faculty member. One of the 3 should be from a faculty member of some variety. Is that correct?
Correct.
Okay, so beyond that, it can be a TA, it can be somebody from a research or a field site that you've worked with. Like it can be a non-faculty member beyond that one academic faculty
Correct. So
member,
first
correct?
letter, faculty member, second letter. So faculty means professor. Um,
Lecturer.
it could be a secondary. So I see the question here. It could a TA. A TA can write your second letter, but for your first, you want to see a faculty. And some, faculty, we have graduate students who teach courses and we still use them as faculty. So lecturers, anyone teaching a course.
Yeah, anybody who's the instructor of the course.
Yes.
Yep. Yeah, excellent. Okay, so that one's answered.
So it looks like we've answered all of our Q&A here. I think for the sake of time, I'm going to send out the rest of these frequently asked questions through email. I have everyone here has registered for for this event, so I have your email address.
Yep.
So I'm going to just go ahead and send these slides out to you so that you can see, kind of review them on your own. So
can I say something about pre-meds really quick, since this is sort of an area that I've been involved with? So I do think that this is a great program for pre-meds, honestly. I worked with Kaplan a few years ago when they first created a new section on the MCAT, which is a social science section on the MCAT. It was clear that medicine is valuing social science experience more now than ever before. Medical schools are looking for students who have multidisciplinary skills, who have social science experiences, who have field experiences, community-based experiences. And so this is a really great stepping stone for you if you want to go on and go to medical school. Not only strategically for like helping you get into a program, this will help you stand out compared to your peers who just did a straight biological science course of study. But just think about long term, what kind of a doctor do you want to be? And how would a program like this and what you expect to learn here, how would it help you be a better physician later on in your career? And I think that just in terms of your own personal and professional development, it's a good thing to do if you have the ability and the time to take a year to focus and think deeply about these issues. It's going to make you a better professional in the long run. So I just wanted to reinforce that, as that is one of our common frequently asked questions.
Absolutely. And I'd say 20 to 30% of each cohort is planning to apply to medical school or to PA programs. So, they're definitely using this to kind of enhance their understanding and their qualifications. So we answered the question on letters of recommendation. What type of jobs? I think this one actually would be good to end on for us. You want to go ahead and take over on this?
Yeah, sure. So there is a question that some students have about what is the value added of spending an extra year in school and investing some time and money in additional training? Is it really going to pay off? And my answer to that is, most definitely. If you think about any job that you're able to get, as an entry-level person in global health, if you're entering in with a master's degree under your belt, you're not going to be at the bottom level of the lowest level of the hierarchy in that organization. You're going to be eligible for higher level positions within that organization, or you are going to more quickly be able to establish yourself and move upward within that organization with this additional level of training. So it will definitely qualify you for higher salaries, a slightly higher level position. You're not going to come in as like a program director or a mid-level person, but you are going to definitely be on a track for that to max out at a higher level, right? If you come in with just a BA and you never get a master's degree, you're going to be limited in terms of how far you can rise within any of these type of health organizations. So having this master's degree will make you eligible to rise eventually up to be policy director, program manager, something like that. Whereas if you only have a BA, you're always going to be an associate. You're always going to be kind of a worker bee. You're not ever going to be eligible to run your own kind of a shop or to be part of management and running your own program. So I think it does have that value, definitely an added value over just coming in with a BA degree.
I agree. And when we were working on the proposal to develop this master's program, we sorted through many global health job postings out there on the internet. And I encourage you to do the same, kind of be looking at the qualifications that they're listing that they want in an applicant for positions that you're interested in. And, 9 times out of 10, we're seeing 5 years of experience at a like exec or, manager level in global health or equivalent, education in the field. Oftentimes it'll be its own bullet point that they want you to have a master's degree in a related field. So that's something that when we were looking at would this program be valuable, we realized that there's so many students looking to go into the field of global health, and we all know how diverse that can be. And there's not really there's so many different trajectories, but not one with this type of background that's gonna, maybe, so some students may want to go into, into epidemiology, and they, an MPH may be more valuable for where they're trying to get in their next steps in the career field. But for those, looking to go working with NGOs or working in program management or running a healthcare facility or working, internationally in healthcare settings, this program is really going to give you that boost, and it's extremely unique. And, if you're looking even to go into social work or different types of fields that don't have the term global health in it, this is still going to be valuable because you're going to be able to sell yourself of the background that you've acquired, the cultural competencies and the skills that you've gained, the communication skills. So I think another thing employers look at when you have a master's degree, you likely have a higher ability to communicate results effectively. And you'll see in a master's
and solve problems, right? And just
right.
Be more analytical and thoughtful about everything that you do.
Right. So in a graduate program, you're going to be reading a lot. You're going to be writing a lot, and there's a reason for that. It's giving you these skills that are going to put you at that next step to be a manager, to succeed in medical school, to to advance you in those next steps. So with a bachelor's degree, there's a limit, right? And then with a master's degree, say you enter a job that you could get with a bachelor's degree anyways, but you get a 2 years experience, and then the options to move up really are so much more exponential than having just a bachelor's degree. So there's always that balance of work experience and education, right? So there's going to be instances where work experience will be more valuable, so it's a balancing act with that, but this is kind of giving you that leverage for the future. So you might not see the immediate benefits a year after graduating, but 3, 4, 5 years after graduating is where you're really going to see your potential realized, and maybe sooner. So it just really depends on each student.
And we're a new program, but we're working hard to grow our program and to create connections with established pipelines of organizations and build relationships. And so we hope, over the next few years to really be able to, create more established, opportunities for internships, field experiences, and post-school employment through creating, relationships of, recruiting and information sharing, and, try to build more relationships in the larger sort of ecosystem of global health organizations in the future. And so we're really trying to move in that direction. So we're always mindful about how we can help you connect with the larger system of potential employment, and that's only going to get better over time.
Yes, absolutely. Let's see, we might have one more question. So for those that are non-global health majors applying, are we required to complete the 3 courses mentioned earlier to fulfill our admissions requirements? No, you're not required. I would say it will look good on your application to have some global health coursework. So if you can enroll in something fall quarter, even winter quarter, so we'll see on your transcript that you're enrolling in global courses. I think that's really going to help. I think it's going to give you a foundation to succeed in the program. It's going to be really a crash course to come in with no global health experience.
Yeah, to be honest, like, not to cut you off, Brittany, but to be honest, like, for somebody who's spent most of their life studying, most of their career studying, biological sciences, if you haven't had some experience with the type of coursework that we do here, it can be a difficult transition. So having taken some courses and have some demonstrated, achievement in making it through and demonstrating that you can do that kind of work, it can really bolster your case and make you look much more appealing as a candidate, because we now get to see that, okay, not only are you crack smart and awesome with your science background, but man, like, you really do get it, and you can actually perform in, in classes that require a lot more understanding of theory and interdisciplinary relationships, and that require a lot of writing and producing, and assessing literature in a different way than you're used to in just a science class. So there is a little bit of a challenge of making that transition. So having taken some courses is a way for you to demonstrate your ability to do that. And so it makes you a stronger candidate.
Yes, and just one other point on that, or maybe two other points. You never know who's going to be on the admissions committee. And I'll tell you, they're always global health faculty. So taking a global health course and having a faculty member know you can be really valuable because they may advocate for you. And I've seen them advocate for students many times. And then another point is if you have not completed these courses, when you come into the program, you're going to have to take a graduate level version of these courses, and you're going to be taking them simultaneous to your graduate core courses. So you're going to be playing a little bit of catch up, but you're also limiting the awesome global health graduate elective courses that you can take for us. So I think that's, just something to make note of, is that our graduate level electives are pretty stimulating, and they may help you in your writing if you're doing the thesis or for your exam. So it limits your options when you are in the program.
Absolutely. All right. So we still have about 20 people left in the room. Any final questions or comments that you all have before we come to a close? No? Okay, Brittany?
Well, you guys know how to contact, because I know many of you have contacted me, and I've met with several of you. So
where is this going to be posted? Sorry, this is one thing so I don't forget.
Yeah, so I'm going to post this on our Facebook page. If you're not following us, I highly recommend it. So UC San Diego Global Health Program. I have the registration list from this event, so I will be sending it out to all participants, and we will post it on the graduate page as well, the overview page. So you'll receive an email. If you aren't signed up for this, for this specific MA info session, feel free to send me an email and I can send it to you. So it's probably going to take probably a day or two to get everything organized to send out. Takes a while to upload once you record. So with that being said, there'll be many avenues to get this information, but please feel free to reach out. I'm hearing from a lot of you, so I know that you know how to utilize this tool, but I'm happy to have a call or a Zoom session with anyone who has any questions. And yeah, stay tuned.
There was one question about practicums. I'm not exactly sure what a practicum is, but they're asking if there's a practicum. Do you know what that
so a practicum within the master's program, no, there is not. Some students were involved in HFIT, or they did find research experiences that they participated in. And same with at the undergraduate level, there's the Life Scholars Program. There's all these programs that have credit and they are a practicum, and you can enroll in a graduate level version of that to receive credit. The reason we didn't include a practicum in our program is because we're a 1-year intensive program. If we expanded the program to 2 years, we would definitely have a practicum component to it, but we evaluated the workload and how much could actually be accomplished in a year, and it didn't add up that you could combine all this into a 1-year program. So something we will consider in the future is to expand and have a 2-year option, but at this time, based on the feedback we received from students, the 1-year program was more valuable to help them jumpstart into their future career or on the road to med school or PhD programs.
Excellent. Thanks for coming, everybody.